following is a paid program. WFEA is not responsible and accepts no liability for any of its content. The opinions, views, and advice expressed during the show are solely those of its participants, and not those of WFEA, its advertisers, or management, and should be used as such, as every individual situation is different.
It's time for On Call with Minuteman Health, bringing you an hour discussion with New Hampshire physicians and healthcare experts on topics ranging from specific medical conditions to our changing medical system. On Call with Minuteman Health, helping you understand healthcare. And now, here's your host, Scott Colby.
Good morning, folks, and welcome to On Call with Minuteman Health. I'm your host, Scott Colby, and welcome to Wednesday. I'm pleased to have Bill McCormich, a return guest, in the studio with me this morning. Good morning, Bill, and welcome to the show.
Good morning, Scott. Thanks very much for having me back today.
Oh, glad to have you back, Bill, anytime. So for our listeners, to reacquaint them with Bill, I would like to introduce Bill as the pharmacy manager for the Elliot Pharmacy at River's Edge. And let me give our listeners a little bit of background before I do a shout-out to my sister, Bill. Sure. How does that sound?
Quite all right. Go ahead.
All right. So Bill McCormich, again, is a registered pharmacist. He earned his doctorate of pharmacy from Rutgers University and, again, is the pharmacy manager here in Manchester at the Elliot Pharmacy at River's Edge, right on Queen City Ave, I guess is what we could call the address, right?
At the River's Edge, yeah.
Great. So before we get started, I would like to give a shout-out to my sister, Laurie, who is in recovery from knee surgery and doing very well. And I told her just before we went on the air that I would give her a shout-out. So, Laurie, keep up the good work on your rehab. And she's actually told me, Bill, that she is now off her pain medications, which is good. And that gets into today's topic, which is respecting your prescription medications. So, teeing it up for our listeners, Bill, this coming Saturday, April 30th, is National Drug Take-Back Day. And this happens periodically. And I was wondering if you could tell the listeners what National Drug Take-Back Day is, and that will ultimately lead into our discussion of respecting your prescription meds.
Sure. Thanks, Scott. So Drug Take-Back Day is an event that's been happening now for several years periodically, and it's run it's run with the cooperation of local communities, the police departments, the DEA, and the goal of it is to collect unused medications.
Right.
So yeah, this Saturday from 10 to 2 at many locations statewide is going to be this collaborative effort to have this Drug Take-Back Day.
And the Elliot Pharmacy at River's Edge is going to be one of those collection sites Saturday, right?
Yes, indeed. We are one of those sites.
Very good. Generally speaking, Bill, and before we get into the success that you had last year with the same program, where can folks... Let's just jump right into it, right? Where can folks typically go if they, let's say they live outside of Manchester, and where can they get information about this?
So if you look on the DEA website right now, they have a great function where you can search by zip code, and you can find all the collection sites that will be available this Saturday. And just before I came on the show here, I did look up a list, and it seems that even within a 25-mile radius of our store over at the River's Edge, there's at least 15, if not 20, different sites that are available to drop off your drugs at.
Wow. So I live in Londonderry, and it's funny because just yesterday, and my wife didn't realize that you and I were going to be doing the show today, my wife mentioned to me, I just read in the paper that the Londonderry Police Department is now taking back unused medication all the time, 24/7. You can just drop it off there. And she said, I have a whole bag of it at home. I have no idea what's in there, Bill. But there's apparently a whole bag of it. And that's great, right? So
yeah, it's perfect. And we see that happening a lot is that folks they tend to accumulate their medicine over time because they don't know what to do with it. And that's exactly what the Drug Take-Back Day is for. And we see lots of people coming over with those, big gallon-sized Ziploc bags full of old prescription bottles. And that's exactly what this program is for.
So let's Elliot participated in this program last year.
Yes.
And you said, I was actually amazed at the amount of unused prescriptions you collected. What was it?
It was unbelievable. It was something to the effect of about 700 pounds.
It's incredible.
It was 11 full boxes of medication. And they're big boxes. They're not small.
Right.
Yeah.
Now, you had an incentive. And I'm assuming that you have an incentive this year as well. So please, this is a plug for you folks.
Yeah. So we will be offering a coupon of some sort. Last year we were giving away free pill boxes. I have a feeling.
Oh, that's a great idea.
I have a feeling we might be doing the exact same thing this year. So we did order
a friend might have told you.
But there will be a coupon, and we saw an awful lot of people, coming in the store asking questions about it, about the drug take back day, it was tremendously successful.
Great, and a drug pill box too. What a great idea! Because one of the things we're going to talk about, or a couple of things we're going to talk about, is not only proper storage of your medication, but the importance of completing the regimen, right? Completing the prescription that was given to you, and if you're on maintenance medications or what have you, you have to stay on that regimen, right?
Yeah, it's a nice segue for the patients that drop off the unused medications, that these pill boxes are kind of to help people stay a little bit more organized with their medications.
Right. So what were some of the drugs that you actually saw coming back? Now, I want to make sure that I give you a chance to speak about anonymity, right? So, but the drugs in general that you saw coming in.
Yeah, disclaimer. So we don't analyze any drug that gets put into the box.
So you're not going to see that Scott Colby dropped off oxycodone.
Correct. It is 100% anonymous.
Good.
There is no collection of patient data.
Good.
There is not even collection of which medications go into the boxes at the time.
Right.
So, but the data out there and the research indicates that what gets turned in at these types of events runs the gamut of everything that we carry in the pharmacy.
Right.
Folks who are out there, maybe they were on a medication and their doctor changed their therapy. Let's say they were on a blood pressure medicine, and your doctor changes you to a different blood pressure medicine. What do you do with the old pills?
Right. Right.
Let's say you were taking an antibiotic and you failed to complete the therapy. That you might end up with a half-used bottle of pills.
Right. And it's funny because we're talking about the take-back of prescription medications, so they are secured, presumably legally.
Mm-hmm.
But regardless of how you have these prescription medications in your possessions, if you want to get rid of them, it is anonymous, as you said. It kind of reminds me of like tax amnesty day. No questions asked. Just bring them in, drop them off, you're done with them. Get them out of your medicine.
And that's how we see almost all these transactions occurring. It's pretty much people show up, drop off their medicines. It's such a simple transaction.
Right. Yeah. And one of the things that I asked you about, Bill, when we were preparing the show was, what does the DEA do with them? And while we don't know exactly the site, if I'm not mistaken, you said that they typically collect them and bring them to a secure facility where they are incinerated.
Yeah, they are incinerated. With the cooperation of the EPA, they make sure that they do it in an environmentally sound way.
Right. So, and that keeps, and we're going to get into this in a few minutes, but that keeps the drugs out of our water supply.
Right.
Those drugs that shouldn't be flushed down the toilet.
It's an important topic.
Yeah, and we'll get into that. So we have a couple more minutes before we go on break, Bill, and maybe actually we have less than a minute before we go on break. Heather just kindly corrected me. Thank you, Heather. She's shaking her head. You're welcome. But let's start the discussion about the importance of drug adherence. So if you're on a maintenance medication for cholesterol or for maybe high blood pressure, talk about the importance of drug adherence.
So a lot of medicines rely on the fact that the medicine is present in your bloodstream in a sufficiently high level in order for it to work properly. And if folks out there are skipping doses of medicines or they don't take them every day if they're supposed to take them every day, it leads to lower blood levels than are necessary for the drug to even sometimes work.
Okay. And one of the statistics that you gave me as we head into break, Bill, is that with HIV medications, while they are maintenance medications, they require a 97% adherence rate.
It might even be higher than that for some of the other ones. Yeah, I mean, it's you have to
very
be
high,
very high, extremely high.
So when we see medications coming in, again, it's anonymous, but when you see maintenance medications come in, you have to ask the question, like, why? Hopefully people are just either changing a dose or, it happens. People pass away, and what do you do with the meds, right?
Exactly.
Exactly. Well, Bill, we are up against break now, so we are going to cut away. And when we come back, let's talk a little bit about the recommendations of proper disposal of unused medications. Folks, you're on call with Minuteman Health. Bill McCormich, pharmacy manager for the Elliot Pharmacy at River's Edge, is in this morning to discuss respecting your prescription medications. We'll be right back.
People are finally doing something about the rising cost of their health insurance. They're switching to Minuteman Health. Minuteman Health could save you $1,000 to $5,100 a year on your premiums. Enroll at MinutemanHealth.org. Savings based on healthcare.gov comparison of the lowest cost 2016 silver plans for all carriers in 03215 for a family of 4, 2 adults age 40 and 2 children under 21, all non-smokers. Provider networks, benefits, and cost-sharing amounts vary.
St. Joseph Hospital now gives you more room to relax inside our new wide-bore MRI, used to help diagnose possible injury or illness. Patients who might find conventional closed MRIs difficult to tolerate no longer have to sacrifice comfort for the quality of their images. St. Joseph Hospital's new MRI unit will provide you with a faster, quieter, and more comfortable MRI exam without that closed-in feeling. We offer appointments 7 days a week for added convenience, and we promise to provide your exam results as quickly as possible. Top quality imaging for precision diagnosis. Expert care in a stress-free, patient-friendly environment. The latest innovations and technologies. It's just what you'd expect from St. Joseph Hospital. To learn more about our new wide-bore MRI, visit us at stjosephhospital.com. That's stjosephhospital.com.
When your diagnosis includes the word cancer, you want your care to be the best possible. At New Hampshire Oncology Hematology, their mission is to provide expert and compassionate care for adults with cancer and blood diseases. Their providers are committed to their patients and their fight. All members of their staff value honesty, teamwork, and communication with patients, their families, and all members of the care team. You and your family will always be treated with dignity and respect at New Hampshire Oncology Hematology. To learn more about their cutting-edge care close to home, visit NHOH.com.
You're listening to On Call with Minuteman Health. This show is informational and not intended to be used as a way to diagnose or treat medical conditions or to replace an appointment with your medical provider. For immediate and medical attention, consult your primary care physician, call 911, or seek care at the nearest emergency department at a local hospital. And now back to On Call with Minuteman Health.
Good morning, folks, and welcome back to On Call with Minuteman Health. I'm your host, Scott Colby, and in the studio with me this morning is Bill McCormich, Pharmacy Manager for the Elliot Pharmacy at River's Edge. And Bill is in this morning to discuss respecting your prescription medications, because Saturday, April 30th, is National Drug Take-Back Day, which is sponsored by the DEA, the Drug Enforcement Agency of the federal government. Bill, once again, thanks for joining me.
Thanks, Scott. Yeah, this Saturday from 10 to 2,
yep.
We'll have a tent set up.
Oh, great. It's outside.
Well, it's outside. There's a tent set up. There's going to be representatives from the Manchester Police there.
So it'll be a secure environment?
Yep. Representatives from the Elliot, and we'll have those boxes out there ready to accept whatever prescription medications you have in your house.
Good. And for folks who might not be familiar, the Elliot Pharmacy at River's Edge is right on Queen City Ave here in Manchester.
That's right.
And if you happen to live outside of Manchester, check the DEA website, but a lot of the local police departments are now participating in this. Not all of them, but a lot are. So check the DEA website.
Yeah, and just a real short list. Manchester Police Department is one of them. Hooksett, Bedford, Auburn, Goffstown, Merrimack, Londonderry, and countless other ones are all participating.
Great. Well, thank you for that abbreviated list, Bill. So when we went on break, we were talking about the importance of drug adherence, right? And that is, if you're on a maintenance medication, the importance of taking what the physician has or the nurse practitioner has prescribed for you, right? But that doesn't always happen. So we end up with medications. Maybe the prescription changes, as I mentioned. Maybe a loved one has passed away and there's a whole inventory of medication, or maybe for whatever reason you've just decided to stop taking them. There are recommendations on how to dispose of medications, and one of them is through this effort, the Take-Back Day, right? Or, as I mentioned in the last segment, Londonderry now takes back drugs 24/7. And so in Londonderry we can do that. But the DEA, the FDA, and the EPA have recommendations, and I was wondering if you could talk to us about what to do with meds if you're not going to drop them in a drop box during Drug Take-Back Day.
Yeah, and it's good because for such a long time, going back the past 15, 20 years, there was a lot of disagreement between even government agencies about what to do with your medications.
Sure.
And I'm really happy to see that the message at this point has really been consolidated, and there seems to be a lot of good agreement about what to do with your expired, unused medications. So as far as that goes, the first and foremost place you should be disposing of your drugs is at a drug take-back day.
Sure.
It's the perfect time and place to do it. Therefore, you know the drugs will be safely taken care of and disposed of in a safe manner. And
no questions asked for these prescription drugs. And I want to underscore prescription.
Correct. Yes.
Yep.
Yeah. Now, if if there's not a drug take-back day, and the last one was last year at this time, so if you can't wait a year, and most folks can't, if you can't wait a year, then you can take them to an authorized collector site.
Okay.
And right now in the state of New Hampshire, there is many police departments, like you said, with Londonderry, are already authorized collection sites.
Right.
And again, that list is available on the DEA website, who the collection sites are. And just before the show, I know I mentioned real quick to you, there is some state legislature right now out there. There's an amendment
pending in the legislature.
There's some pending movement on permitting pharmacies to become authorized collection sites. So I'll be really excited to see how that turns out.
Yeah, that's great. I mean, we want to try to make it easy for people. Again, we want to encourage drug adherence, but at the same time, we want to encourage proper disposal.
Right, and because the real danger here is that if you have medicines in your house that either you don't use anymore or there's somebody else's, these could be potentially dangerous drugs for someone to inadvertently ingest.
Right.
They're dangerous drugs if for a family pet.
Yep.
Rex the dog, swallows some pills.
We were talking about Rex on break.
If he swallows some tablets, it could be, very dangerous.
Right.
So you want to make sure that the drugs are taken to a place that they're safely disposed of, where people and animals aren't going to get into them and take them.
Exactly. And in a few minutes, we're going to talk about proper storage and keeping our pets and loved ones safe. But for right now, what do you do if there's not a drug take-back day and you want to dispose of something?
Yeah.
There are several different types of medications we need to talk about separately. Let's talk about the most important one that I see, and maybe it's not the most important, but I think it is the proper disposal of opioids.
Right. Those are some of the most dangerous drugs for you to have in your house.
Right.
Because even a single dose of some of these medications, one single dose could land somebody in the hospital or worse.
Yep.
So we want to make sure that these drugs are not in a place where they could ever be inadvertently taken by somebody.
And I would encourage the listeners to not think of it, it's just pain medication. No. These are very serious drugs.
Oh, yeah. Yeah. So if you can't get to a drug take-back day, if you can't get to an authorized collector, the DEA, the FDA, and the EPA have come up with this essentially flow chart of what you can do with your medications, including controlled substances. And the first thing you should be doing, is you should be placing them in a sealed, watertight container.
Okay.
Something as simple as a used soda bottle.
Okay.
Some people like to use detergent bottles, too, especially if they have used sharps. A sealed detergent bottle is good.
And, Bill, just a point of clarification, you're talking about all drugs at this point, or are we
all
just
drugs.
Starting with... Okay.
All drugs.
Okay, so all drugs, sealed watertight container.
Sealed watertight container. Toss some water in it, shake it up.
Okay.
That'll pretty much destroy the medications to the point where people and animals going through trash won't go through them and you want to get at them.
Okay.
Other ways you can render them undesirable, mixing them up with kitty litter.
Okay.
Coffee grounds. You and I love coffee.
Yeah.
Plenty of coffee grounds. Or sawdust. Something that is essentially not tasty.
Okay.
And
water as well. So it's
water.
Like a mush. So kitty litter with water in the pills, and then they dissolve, and it's gross.
And then pop it into a plastic bag.
Okay.
And for most municipalities, those should either be thrown out with your household trash.
Yep.
Or if you contact your municipality, sometimes they do have hazardous waste collection sites.
Yep.
Depending on the municipality or the county.
Right. And but for opioids, I thought I heard you say we never dispose of those in the trash, right?
So opiates are the exception, and those are the strong pain medicines. Those are the ones that are your morphines, your oxycodones, hydrocodones, fentanyls. So for these specific drugs, they really need to be taken back to an authorized collector site. That really is the safest way to get rid of them.
Okay.
But if that is not possible, then the recommendation is actually to flush them, believe it or not.
Okay. And why is that, Bill?
Because we want to make sure that they end up in a place where they can't inadvertently be taken. If you were to ingest one of these drugs, a certain amount of the drug leaves your body unchanged. So the thought is that we should be concerned with what we're putting into our groundwater.
Yeah.
Because if you put something down the sewer, or if you put something into a septic tank, yes, there will be leaching into the groundwater, and we're not really sure what kind of effect that's having. So we really want to avoid those drugs getting into the groundwater.
Like with antibiotics, we don't want them. hormones?
Antibiotics and hormones. So, I mean, lots of testing has been done on groundwater, and the drugs do show up in testing. We're not sure what the clinical significance of that is yet, but we want to be better safe than sorry here.
Sure.
But for opiates alone, because they normally do pass through your system in some part unchanged,
yep.
The consideration right now is really safety of the drugs, that they're not in a place where somebody can get at them.
So said maybe a little more scientifically, some of these other drugs, like antibiotics and some of the medications that you might take for high blood pressure, your body metabolizes those and breaks them down. Mm-hmm. So if you just throw them away and discard them, they can end up in the water supply in an active form. But an opioid that your body doesn't really necessarily metabolize and can actually be secreted, at least in some level of strength, it's not as much of a concern.
Yeah.
Again, take back day, collection sites, that's number one.
Yeah.
But an opioid down the toilet is okay.
Yeah, and if you look on the DEA and the FDA websites, you'll find the same information that flushing those specific drugs, and there's a list on the DEA website about which drugs you are permitted to flush.
Yep.
And they're all pain medicine.
So a few minutes ago, we mentioned how the DEA comes in and they take these boxes to secure locations, we don't know where they are, and they incinerate them.
Yep.
When we were talking, one of the things that you said to me is, we've got to make sure, Scott, that we get the point across, don't burn these yourself. Why?
No. Well, because
there are a lot of whys.
Yeah. I don't know that there's any research out there that shows that burning medications is a good idea. Who knows what would happen in your backyard, the incineration process, as to what kind of chemicals you'd be expelling into the atmosphere.
Right.
And
ingesting, inhaling.
Yeah.
Right?
No. So nobody out there has ever suggested that somebody should be burning these at their house. That would not be a good idea.
Right. So for antibiotics, for hormones, which would include birth control pills, I'm assuming, for statins and all of these different drugs.
Cholesterol medicines.
Right? Yeah, all these different drugs, you can try to destroy them by putting them in unpalatable mush in a sealed container and discarding them in the trash.
Yeah.
Opioids, on the other hand, must be taken to an authorized site, collection site, or discarded down the toilet.
Yes.
Okay.
That's exactly right.
Good. Do you think I have that covered?
Well, you did pretty good.
All right. So, again, we have a couple minutes before break, and we're going to move into some other topics now, Bill, about respecting your prescription medications. But before we do, let's remind the listeners again about what's happening on Saturday.
This Saturday is National Drug Take-Back Day.
Yep.
It's occurring at many sites nationwide and statewide, including over at Elliot Pharmacy at River's Edge.
Yep. It's
from 10 to 2 this Saturday, April 30th.
Great. Very good. Very good. So, Bill, let's move over now. And we have a few other topics we'd like to discuss this morning, including, just to give the listeners a little bit of a primer here, expiration dates, proper medication storage, the influence that medications can have on coordination and doing activities like heavy machinery and driving. But let's start with expiration dates.
Yeah.
And expiration dates apply primarily, we think of them as it relates to over-the-counter meds, but expiration dates would apply to everything, it would seem.
Yeah, so all prescription medications have an expiration date on them. When you get them at the pharmacy, you get them usually in one of those amber-colored pharmacy vials.
Right.
There will be an expiration date printed on it, which is typically going to be 1 year.
I've never noticed that.
Yeah. If you look closely, there's going to be an expiration date on the bottles. The stock bottles that we carry in the pharmacy typically have expiration dates that extend beyond that, but once we repackage them, we're only permitted to put a 1-year expiration date on it, or the shorter one that's on the shelf. So a lot of times I get the question, are my expired medicines still good? Are they still safe to take? And I try to relay some information to the patient in that on the date of expiration, one of two things is going to happen. Either the standard of the medication to be at least 90% present is still there, or on the date of expiration, it could actually have degraded to the point and could actually do you harm.
Okay. Well, let's hold that thought for a second. And when we come back, let's talk a little bit more about the importance of adhering to the expiration dates and go with that 90% effective threshold. Folks, you're on call with Minuteman Health. We're here this morning discussing respecting your prescription medications. Bill McCormich, pharmacy manager for the Elliot Pharmacy at River's Edge, is here. We'll be right back.
We didn't start with the idea of a new facility, but as ideas evolved, they led to the Elliot at River's Edge.
Elliot Orthopedic Surgical Specialists is a group of highly skilled doctors.
We provide comprehensive diagnostic testing for sports injuries and other mishaps.
Whether we repair, replace, or reconstruct hip, shoulders, hands, or knees,
our doctors will diagnose and begin treatment plans right away.
I'm Dr. Mary Lee Soul.
I'm Dr. Jonathan Mack.
I'm Dr. Paul Scabetta.
I'm Dr. Martin Ross.
I'm Dr. Rob Parisian. Our complete orthopedic team is ready to treat you.
The Elliot at River's Edge is now home to the most advanced ambulatory health care in New Hampshire. It's also comforting to know that Elliot Surgical Specialists and the nationally acclaimed Elliot One Day Surgery Center are at the Elliot at River's Edge off Queen City Avenue. Elliot at River's Edge. We're ready to get you back to your active life. For more information, go to ElliotRiversEdge.com. At Catholic Medical Center, we believe that excellence in healthcare and personal respect for our patients go hand in hand. From our primary care and laboratory services, the Mom's Place, to our minimally invasive robotic surgery, CMC meets your every healthcare need. Our expert specialists and caring medical staff are dedicated to being your lifelong partners in good health. CMC, leading the way with heart. Find out more at CatholicMedicalCenter.org.
When you have digestive problems, you need to turn to a gastroenterologist who listens and responds, an experienced doctor who knows the field and can effectively diagnose and treat your needs. New Hampshire Gastroenterology in Bedford is now opening a new office in Nashua. You'll receive the same superior and compassionate care from their dedicated team of trained gastroenterology professionals who give you the individualized care that you deserve. Call New Hampshire Gastroenterology today at 625-5744 or visit nhgastro.com for their 2 locations in Bedford or Nashua. You're listening to On Call with Minuteman Health. This show is informational and not intended to be used as a way to diagnose or treat medical conditions or to replace an appointment with your medical provider. For immediate and medical attention, consult your primary care physician, call 911, or seek care at the nearest emergency department at a local hospital. And now back to On Call with Minuteman Health.
Good morning, folks, and welcome back to On Call with Minuteman Health. I'm your host, Scott Colby, and in the studio with me this morning is Bill McCormich, Pharmacy Manager of the Elliot Pharmacy at River's Edge on Queen City Ave in Manchester, and Bill is discussing respecting your prescription medications. Bill, when we were on break, an issue came up, and I wanted to just mention this very quickly, and that has to do with over-the-counter medications and whether the drug take-back. What do you do with over-the-counter meds? Like, how do you dispose of them?
Yeah, so if you have over-the-counter meds that you don't take anymore or over-the-counter meds that are expired at home,
yep,
we are taking those back at Drug Take-Back Day as well. They go in the exact same place.
Great. So that's good news. So, folks, prescription medications and over-the-counter meds that might be expired or you're just not taking anymore again, dispose of them on Saturday, 10 to 2.
That's right.
So when we were on break, I came clean with Bill, and he goes, oh, you have to mention this story.
Yeah.
So it's allergy season, and I get pollen allergies early in the season. I don't get them in the summer, thank goodness. And I went into the medicine cabinet, or my wife did, and she pulled out 3 boxes of generic Loza, what is it called? The
Loratadine.
Loratadine, thank you. Right. We think of Claritin. It's not an endorsement. Right, that's a brand name, but Loratadine. So 10 milligrams. So she pulls them out, and the first box she pulls out had 3 pills in it, and it was expired May of 2013, 3 years ago.
Oh, boy.
Then the second one has probably, doing the math in my head, maybe 16 to 20 tablets, almost a full box, that expired December of 14, so getting better. And I'm on those now. And the last one expired May of last year, May of 15. And so my question to you, Bill, he's laughing at me right now. So I took the 13s. I'm into the 14s now. What should I do with them? Should I keep taking them? Or?
So, I get this question all the time back at the pharmacy.
Okay.
And there's this tendency sometimes for folks to say, oh, if I buy the 500-count bottle, that's a great idea because it's a lot cheaper. But then they don't realize that when they buy that 500-count bottle, they might not actually use all the medicine before it expires.
Right.
And probably like yourself, a lot of folks out there don't realize what happens when the drug expires or what exactly happens. Nothing magical happens on the date of expiration where the drug all of a sudden stops working altogether.
Right.
But and also the manufacturers typically do put pretty conservative expiration dates on them, but we don't know how conservative. The date of expiration the FDA rule is that the drug has to be, at a minimum, 90% still viable, still useful. So your 10 milligram loratadine tablets, on the day they expired 3 years ago in 2013,
9 milligrams.
They were 9 milligram tablets, or they could only be expected to be 9 milligram tablets.
Okay.
And then as time progresses, nobody is really certain of the amount of degradation that happens after that. So you may very well, and this is just, pulling out of nowhere, but you may only be taking 4 or 5 milligrams of a drug that is labeled 10 milligrams because it expired 3 years ago. So my recommendation is this to people. Number one, don't take drugs that are expired.
Okay.
Because not only was it a waste of money for you to buy the drug, but number two is that you want to make sure that you're getting the full utility out of that medication. If it says 10 milligrams, you want to make sure you're getting as much use out of it as possible. So make sure when you buy these drugs, you don't buy the 500 count amount that's going to last you 3 or 4 years. Look at that expiration date.
In a word of caution, too, as Bill just said, for the listener's benefit, we can't make any assumptions about a year after expiration it's going to be 50% potent, so you can just take 2 pills. No. Now you're getting into guessing games, and you don't want to do that.
Not worth it to do that to yourself. So once the drug expires, get rid of it.
Right.
There's no sense in hanging on to it after it expires. There's no healthcare professional that's going to go out there and say it is a really good idea to take an expired medication.
Exactly.
So you're always better off with fresh medications. And take those expired drugs. What are you going to do on Saturday, Scott?
I'm going to take them to I actually might do it tomorrow morning because in Londonderry it's a 24/7 program now, so I might be able to get rid of them. Yeah. But Bill, what I don't want to do is I don't want to caution the listeners that the only effect of taking a medication beyond the expiration date is that it might not be as potent as it was intended to be. Mm-hmm. Because when you and I talked, you mentioned that there are actually some medications which can cause you physical harm.
There's not many, but there are a few.
There are, right. So let's talk about those.
There are a few. And the first one that comes to mind is the tetracyclines.
What is a tetracycline?
Tetracycline is a class of antibiotics.
Okay.
And you might even have, at this point, expired tetracycline in your medicine cabinet. And if you have expired tetracycline, do not take it.
Okay.
It is not safe to take. Expired tetracycline can do you harm.
Can you think of a generic or something that would bring it? Would it just say tetracycline?
It may just say tetracycline. It could also say doxycycline. Is also in that class as well. That's a more common one nowadays.
Okay.
You don't see a lot of bottles that say tetracycline. It's been unavailable for a while. So if you have some tetracycline or doxycycline that's expired, get rid of it. Again, it's not particularly safe to continue using those medications after they're expired.
And again, where do you take them? You take them in an authorized center, or you destroy them and put them in a sealed container.
Correct.
Right. Because you don't want to flush those down the toilet.
I would not flush those down the toilet.
Okay.
No.
But so they can actually cause you harm?
Yeah.
If they're expired?
They can make you sick. Yeah.
Okay. So very important to pay attention to expiration dates, and for prescription meds, it is right on the bottle as well.
Correct.
Okay. Very good. Let's move over now, Bill. We have a few more minutes left in this segment. Let's move over and let's begin talking about proper storage of medications. And there are some do's and don'ts. There are some considerations to make sure that the medication themselves, over-the-counter and prescription, are stored properly for their own benefit, but also for safety reasons.
Yeah, so medications should be stored in a cool, dry place. And unfortunately, where you store your medications is probably not in a cool, dry place. Most patients store their medicines in a medicine cabinet in their bathroom.
Yep.
Not cool or dry. In fact, it's just the opposite. It usually gets hot and
and
humid.
Moist, right?
Yeah.
Especially if you have teenage daughters. Trust me.
or in the kitchen above a sink.
Right.
Where again, hot and humid is detrimental to drugs. So some drugs tend to absorb moisture.
Okay.
Some drugs break down under heat. So cool and dry is the best way to store your medications. Some folks have a place in their bedrooms that's appropriate, or in an office might also be appropriate. And as long as we're talking about where to store them in your house.
Before we do, though, if I could just jump in 1 second.
Yeah.
So some of us live in the dark ages, and we might not have central air or even window air conditioners because we just don't like them. The Colbys being one of those families. Okay. We just don't. I just, the winters are too long. So we get hot in our house. So when you say a cool, dry place, there may not be a cool, dry place in August. Can you comment on that? No, I'm serious. The house can get up to 90, 95 degrees.
Dark is better. Dark is better. Out of direct sunlight, away from places where heat or sun might heat something up or the container that they're being stored in.
Okay.
So as cool and as dry as you can as you can manage.
But just because we let our house get a little toasty for a few days a year doesn't mean it's going to ruin over the counter.
I think you'll be okay.
Got it. Thank you. I'm very literal, Bill.
Okay.
So we've established that a cool, dry, dark place is where you want to store the meds. Safety,
yeah. Away from children, away from animals. Children and animals are particularly susceptible to poisoning situations. Mm-hmm. I did a pharmacy rotation with New Jersey Poison Control, and while I was there, I heard story after story about a child or a dog. We got those calls too, or any animal for that matter. A child that got into somebody's prescription medications. So your medicines have to be kept in a locked place.
Okay.
Where children can't easily get at them. Store them high up where only adults can get at them.
Mm-hmm.
If you have a locking cabinet, that would be great. Most people don't. But if you have a locking cabinet, that'd be even better. A safe, especially for controlled substances.
Okay.
If you have one of those drugs that puts you at high risk of theft or somebody pilfering them, you need to have them in a locked cabinet or a locked safe.
Mm-hmm. Yeah, one of the most effective drug prevention ads, or drug abuse prevention ads that I thought aired was the one where the elderly person walks into the bathroom to reach into the medicine cabinet and grab the medication, and when they open it up, they shut the mirrored door of the cabinet, and the reflection is there of the grandchild, right? Taking the medication, right? Because that's what can happen.
Yeah.
Loved ones that we might not suspect might stumble upon and say, oh, look at this. Grandma has some oxycodone, and wouldn't it be cool to take that as a high? So you have to be really careful about where you store it.
It's so dangerous. I mean, even one pill of some of these potent pain relievers, even one pill can land you in the hospital or worse.
Right, exactly. So storing them in locked places is important. Bill, we're actually coming up on break in just a couple minutes, but could you talk to us about the management? And this is something you and I didn't prepare for, but I think there's a lot here. How, as especially an elderly person, do you manage your medications and keep yourself from getting confused over what to take and when? That to me seems like a big area of exposure.
It's a big topic.
Yeah.
So one of the things that we do over at our pharmacy is that we do help our patients by putting them into a medication planner service.
A medication
planner. It's a weekly disposable punch card where we put all of your medications in it, and it's such a nice way for people to stay organized with their medications.
I can't visualize that.
Yeah, it's sometimes they call it a bingo card. It's got it's a 7x4 grid with plastic bubbles on it, and then a foil seal on the outside, and so it's just like one of those hard plastic. Weekly medication planners.
Okay.
Monday through Friday, or the Saturday, Sunday, Monday, Tuesday, Monday, and then morning, noon, evening, and bedtime are the 4 different slots.
So all you have to remember then is, it's morning. I'm about to have breakfast. I need medications, and all you have to do is go and punch that.
It's so difficult once you get more than 4 medications. Once you get more than 4, and believe me, there's patients out there on 20 different medications, but once you get up to the 3 or 4 mark, it is almost impossible to not make a mistake at least once a month on your medications. Take 2 of something, skip a dose, take them at the wrong times. It happens all the time. So if you have a pharmacy in your area that provides that type of planner service, especially if you get confused easily, or if there's a caregiver that really just doesn't have the time to do that, it's a lot of work to do that. So some pharmacies do provide that service, and we're one of them.
Great. Thanks, Bill. Well, we are coming up against break, so we're going to cut away right now. Bill McCormich, pharmacy manager of the Elliot Pharmacy at River's Edge, is here to discuss respecting your prescription medications. We'll be right back.
People are finally doing something about the rising cost of their health insurance. They're switching to Minuteman Health. Minuteman Health could save you $1,000 to $5,100 a year on your premiums. Enroll at MinutemanHealth.org. Savings based on healthcare.gov comparison of the lowest cost 2016 silver plans for all carriers in 03215 for a family of 4, 2 adults age 40 and 2 children under 21, all non-smokers. Provider networks, benefits, and cost-sharing amounts vary.
At Catholic Medical Center, we believe that excellence in healthcare and personal respect for our patients go hand in hand. From our primary care and laboratory services, the Mom's Place, to our minimally invasive robotic surgery, CMC meets your every healthcare need. Our expert specialists and caring medical staff are dedicated to being your lifelong partners in good health. CMC, leading the way with heart. Find out more at CatholicMedicalCenter.org.
We didn't start with the idea of a new facility, but as ideas evolved, they led to the Elliot at River's Edge.
I'm Dr. Joe Guanascia. There was a lot of talk about this being the right time for urgent care.
It's a perfect choice to treat illnesses, accidents, or injuries, or when your doctor's office is closed. I'm Dr. Kevin Rankins.
No one wants to take up time in an emergency room when others might need that time for life-threatening injuries.
Urgent care quickly gets you to a board-certified emergency doctor.
These days, making urgent care easily available and accessible means health care is less expensive for all of us.
Urgent care is a great option when you don't need an emergency room visit. I'm Joanne Waska-Cormier, LPN.
Urgent care at the Elliot at River's Edge. It's faster than an emergency room visit.
You're going to love our care.
Urgent care is open from 7 a.m. to 10 p.m. every day. No appointments necessary. Located right off Queen City Avenue at the Elliot at River's Edge. For more information, go to ElliotRiversEdge.com.
You're listening to On Call with Minuteman Health. This show is informational and not intended to be used as a way to diagnose or treat medical conditions or to replace an appointment with your medical provider. For immediate and medical attention, consult your primary care physician, call 911, or seek care at the nearest emergency department at a local hospital. And now back to On Call with Minuteman Health.
Good morning, folks, and welcome back to On Call with Minuteman Health. I'm your host, Scott Colby, and in the studio with me this morning is Bill McCormich, Pharmacy Manager for the Elliot Pharmacy at River's Edge on Queen City Ave here in Manchester. Bill is in this morning to discuss the general topic, respecting your prescription medications. Bill, once again, thanks for joining us this morning, and can you believe it? This is our last segment.
Yeah, I think it's wonderful that you have me on today. Thank you.
Thanks for coming in again. Appreciate it. So when we went on break, we've covered a lot today. We've covered expiration dates, proper disposal of medications, of course, the DEA's National Drug Take-Back Day, which is when?
This Saturday,
April
10
30th.
to 2, at Elliot Pharmacy at River's Edge and at many other locations available on the DEA website.
Right, and I think that's DEA.gov is my guess, but go on the DEA website if you don't live in Greater Manchester and you can find a location.
Yeah.
So when we went on break, we kind of rushed through this, but I want to step back because I think this is really important. It seems to me that an area of respecting your prescription meds is making sure you're doing everything you can to take the right ones. And if you are somebody, or your loved one is someone who is taking 4 or more medications on a daily basis, you can really get confused.
Right.
And they all come in the same little bottle. Mm-hmm. And as we get older, I'm just as guilty as the next person. It's harder and harder to read, and it's easier and easier to make mistakes. So you mentioned medication planner service, and you mentioned that the Elliot Pharmacy here in Manchester actually has a cool program that you offer that planning service by packaging medications a certain way.
Yes, so I guess the industry term would be adherence assistance packaging.
Okay.
So it's packaging of your medications to assist you in taking your medications when you're supposed to take them.
Okay.
So to help you not forget to take the medications. It's hard. Once you get 4 medications, it becomes unbelievably hard to stay on top of it the entire month. So we see people all the time coming in and, buying their, pill boxes, and they spend inordinate amounts of time filling them up, either weekly or monthly. And then you get halfway through the month and you realize I don't have enough of my one medication to fill the planner, so now I got to go back to my pharmacy and get a refill. So with our service, we have a disposable cardboard card that has plastic bubbles with foil wrap on the outside.
Okay.
And the pharmacist will package it, and each card is good for a week.
Okay.
We'll package it to the point where you can very easily stay on top of your medications. So no more missed doses, no more double doses, no more taking your drug at the wrong time of the day.
Yep.
So it's our patients that are on this service love it. They are so loyal to us, and they love the service that we provide for them.
So it's like a bingo card, and across the top where it would say bingo, it'll be Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, and then down the side it'll be morning, noon, night, or whatever.
That's exactly what it is.
Or hours or something like that.
Yeah, there's a couple different options that we can package them in, but that's the most popular option is the weekly pill planner.
Right. So a question comes to mind, because this is new for me. I didn't realize that you guys did this, and I think it's a great idea. For me, if I'm taking a medication and currently not on any maintenance meds, but if I were, a reminder to call and get my prescription refilled would be the fact that my bottle is almost empty. What kind of reminders do people use when they're using an adherence assistance packaging program?
That's one of the best things about the program is that we take that guesswork that you might have.
Okay.
And when do I refill my medicines?
Yeah.
We take it over for you.
Oh.
We take it over.
That's even better.
Yeah. Yeah. We'll either sync up your medicines so that they're filled at the same time.
Okay.
Or we will, fill your medicines at such a rate that you don't even realize that they're being filled behind the scenes.
Okay.
And we'll contact your doctor when you run out of refills, and we'll make sure that you get that planner every single week full of all your medications.
Okay.
And we roll with the punches. So if your doctor changes your drug therapy next week, we can work with that. We can make sure that your next planner has the correct medications.
That's great. And I would assume, Bill, because cost is an important consideration for all of us, especially when we're on fixed incomes, but I would assume that there's a nominal fee associated with it.
It is nominal, and that covers all of the services that we provide for the month. So if there's any repackaging necessary, like let's say you do have a drug change, we don't charge you per card.
Okay.
Whether you get a weekly pill planner or a monthly pill planner, the charge is the same. And if you need to bring it back because you want something else included into it, then there's no charge for us to repackage it for you.
Okay. Are there any do's and don'ts with that kind of a planner?
It's for certain people. It's
certain meds excluded from that.
There are certain meds excluded from it. Medications that are very typically rely on like laboratory work. So if you're on Coumadin, or that's a brand name. If you're on warfarin,
which is a blood thinner.
If you are on that medicine, you get blood tested periodically, and we see doses on warfarin change pretty frequently.
Okay.
That drug is really not appropriate for this type of service.
Okay.
Because then it actually becomes a little bit of a risk. So we try to make sure that if we have a patient on this service that has Coumadin, we'll package it up in either a completely separate container with instructions on it. That way we don't have to unpackage everything 3 or 4 times a month to roll with the changes of Coumadin.
And so what kind of medications might be appropriate for this kind of a planner?
There's
high blood pressure medications?
Blood pressure medications, any heart medication for that matter, including your cholesterol medications, your statins. Any medication, like allergy medications that you take on a daily basis, once or twice a day, 4 times a day, it doesn't matter. The service is very flexible. That it can even accommodate medicines that you only take once a month.
Okay.
Some patients only take a vitamin D capsule once a month, and we include those at the proper date every single month.
Interesting. Well, that's great. Well, thank you for enlightening me, and I'm sure our listeners are more savvy than I am, but I found that fascinating. Bill, we have a couple minutes left. We have about 5 minutes before the end of the show. And it would be really important as we talk about respecting your prescription medications to end the show on safety. We've talked about safety. We've talked about proper disposal of opioids, right? We've talked about the importance of respecting adherence to medications to make sure that they're as effective as they can be. We've talked about respecting expiration dates to make sure you're not taking something that, like a tetracycline, that could actually cause you harm, or just a medication or over-the-counter med that might not be as effective because it's so old. And I am going to get rid of my allergy meds. But what about driving and operating heavy machinery? Some of these medications have serious warnings on them that I'm guilty. I don't really pay attention to them, and I should, right?
Yes. So every time you get one of those prescription bottles, you'll notice that there's
tons of labels,
4
Bill.
or 5 extra labels on it.
You kill me.
All sorts of different colors sometimes.
Heather's shaking her head. It's like, yeah, really?
Yeah, and I know that very few patients take the time to fully read every single thing that's on the label.
We should, but we don't.
Exactly. And, not even just the controlled medications, because I know a lot of people out there, understand that a pain medication like an oxycodone or a Percocet could very easily cause drowsiness, but then they don't understand that other medications that are not necessarily controlled substances can also cause drowsiness or dizziness. And the concern is that those medications will be taken before the patient understands how it's going to affect their ability to operate, and then they do something like get behind the wheel of a car. So let's say your doctor prescribes you a muscle relaxant. That's not necessarily a controlled substance, but it's going to make you dizzy or drowsy. And you take it at the pharmacy or even in the parking lot of the pharmacy, and then you go driving on it, and then all of a sudden you become severely drowsy. That's a dangerous situation.
Absolutely dangerous.
So,
and you could be held liable for any accidents that
think
occur
so, yeah.
as a result.
So my recommendation is that reach out.
But that's a question for Heather's legal show.
Yeah.
That she does on Tuesdays, Heather? Yes, thank you.
So my recommendation is to form a good relationship with your pharmacist. Yeah. Ask questions about your medications. The pharmacist is a tremendous asset to you. They have a wealth of information that you can use. They have a wealth of information about the side effects of your medications. So ask your pharmacist questions about your medications, and they'll help you out and let you know which ones are safe to go driving on, which ones aren't, which ones are safe to operate heavy machinery, or what did we say before? Juggle flaming chainsaws.
Flaming chainsaws. That was Heather's expression, right?
Yeah. I don't know if anybody should be doing that.
No, I don't either. But some of us, and I think you bring up a really good point, Bill, and that is that the retail transaction of purchasing prescription medications, or even over the counter for that matter, doesn't have to be an in and out. They ask you when you pick up the medication, do you have any questions about this? And you should always ask, are there any side effects that I should be aware of? And if there are important side effects, chances are the pharmacy tech or the pharmacist themselves is going to try to explain that.
Right. And the pharmacist that I work with will counsel you about your medications, especially if it's your first time taking them.
Right.
We have to go out there and tell you, a little bit about your medications. Or at a minimum, if you don't have time for counseling right then and there, we could call you. You can call us when you get home. If you have questions about your medications, your pharmacist is available to you to help you with your medications.
Right. Yeah, and they're going to answer the questions. And some of us, we might be auditory learners, and we might not learn as well with reading a label, right? Or we might have an impaired vision or something. So take the time at the pharmacy, right?
Right.
Yeah. Well, Bill, I hear the music in the background, and that tells me that we're wrapping up. This has been a really informative show. A lot of good information was shared. This Saturday, April 30th, what's happening?
10 to 2 is Drug Take Back Day at Elliot Pharmacy at River's Edge.
Yep. And if you don't live in Manchester?
If you don't live in Manchester, check the DEA website. There are dozens of places all throughout the state you can drop off.
Great. It's been a wonderful show, Bill. Bill McCormich, pharmacy manager for the Elliot Pharmacy at River's Edge on Queen City Ave here in Manchester, has been in this morning to discuss the general topic, respecting your prescription medications. Thanks for listening, and make it a great week.